Myself, as well as the other panelists, we are all licensed professional counselors and supervisors and registered play therapists with extensive training in child mental health and play therapy and child development. I'd also like to introduce my panelists. So we have Dr. LaCavia Taylor, who is a clinical assistant professor at the University of North Texas. Her publications and presentations focus on the impact of child-centered play therapy on African American children's social and emotional health and the applicability of play therapy across cultures. Dr. Quinn Smelser is also a clinical assistant professor at Loyola University and a recent graduate of the doctoral program at GW. Yay. Her presentations and publications center on childhood trauma and how play therapy can address trauma and working with gender expansive and transgender children. Dr. Christy Opiola is an assistant professor at the University of North Carolina at Charlotte. She is a recipient of a Best Practices Award for her research. And she focuses on trauma and attachment issues in children and training parents and teachers in play therapy to meet the mental health needs of students and children. And our last panelist is Dr. Dee Ray, who is a distinguished teaching professor and an Elaine Milliken Mathis Professor in Early Childhood Education at the University of North Texas. She is the director of the Center for Play Therapy and has published over 100 articles and book chapters on play therapy, child mental health, and child development. And she was recently recognized as one of the top 25 female professors in the state of Texas. And Texas is big with a lot of colleges, so that's very exciting. So in addition to the research and education that the panelists and myself have, we also provide play therapy services. So we're working with children, and we have done so throughout our careers and into the COVID-19 pandemic. So thank you to our panelists for agreeing to participate and share your knowledge and experience with parents and teachers who may be struggling with how to respond to the many changes and challenges that COVID-19 brought. For the participants, you are welcome to ask questions within the chat, and we'll try and get to them. But first, I'd like to say, part of the reason why I wanted to do this panel was because I myself am a parent, and I have texted or called pretty much all the panelists in, just concern about how my children were responding and asking for help. And I know that if I'm experiencing it, I'm pretty positive a lot of parents are experiencing it. And a lot of teachers are. And so how can we support them? So the first question I thought we could talk about or address would be with Dr. Dee Ray. What have you been seeing and hearing from parents and teachers regarding how children are responding to the pandemic?
Yeah. Thank you, Maggie, for having me. I just want to say thanks for letting me be here today. Yeah, there's so many reactions that people are having, and in my position, I'm honored to be able to hear a lot of that from both parents and teachers and other adults, caretakers working with children. But so many things. I think the primary thing that I see is the level of anxiety being so high among the parents, among the adults that are working with the kids. And that, to me, seems to be the biggest issue on when you're dealing with children and all of the things that they're going through, that what's your level of anxiety? How have you been taking care of yourself? What are your fears in all of this? And so that would be the number one prevalent thing that I've seen. But then, then as far as children, is lots of concern. Are they falling behind educationally? Are they too socially isolated? And then, of course, a lot of behavioral issues. So I think those are kind of the main ones. Are they lonely? My child is lonely. I think I've heard a lot of that. And I'm just going to say, going back to the other, from parents, I think I hear this parallel of I'm lonely that's impacting too. And so, I know the other panelists have more, so I don't want to try and tell all the things I think of. But yeah, that's what I would say the primary ones I've noticed.
I
think one thing I've noticed is it's really dependent on your community and your family system as to what we're hearing. So for some families, they're experiencing a lot of positivity during COVID, that they have felt more connected with each other and have created special times with their family members. And so I think for many of those children, this has been a really good experience. And then for others where parents are extremely stressed or trying to juggle the many roles and hats that they've been forced to put on, like co-teacher, employee, parent, spouse, whatever else might come on there, that has been more challenging because parents have felt that they can't give what they were able to give before because they haven't had an outlet at home. And so I think children might be experiencing that too. I also work in an area with families that are more disadvantaged. And so parents are still having to work, and their children, unfortunately, might have to be left at home alone because daycare centers have been closed, or they have an older sibling watching them, and the older sibling is not doing that of free will. They're doing that because they've been asked to. So there's more stress in the system. And I think those children are expressing stress behaviorally, emotionally. They might have shorter tempers, shorter fuses, get upset easier than they did before, or wanting to be clingier to their parent. And that has been challenging as parental buckets have been pretty empty to be able to give back. So.
Yeah, and I think one thing I'm seeing too is this fear of either getting COVID, family members getting COVID, or if a child does find out their family member is diagnosed with COVID, that can cause a lot of stress. And we know because there's so many increased conversations about this, our children are hearing this. And so they also have this fear, will my parent lose their job? Will someone in my family lose their job? So they're actually getting a little bit of additional stressors than they would normally get under any other circumstances. So you might just hear or you might have experience of what I've heard, a lot of children asking questions. So will you get to go to work? Or how does that work? Are you at home more? And so there's a lot of confusion, I think, that we're seeing from children.
Yeah, I think I'll really echo a lot of what Christy and Dee and LaCavia have said. Maggie, thanks so much for having me. It's really exciting to be back at GW doing this panel. I think the other thing I think about too is sort of how this has brought up dysfunction. So if there was a family that was not coping well already, this has really exacerbated that. And so you see, if there was sort of a low level of maladaptive coping or a low level of things going a little bit, not the way a family or a parent would want them to, this unfortunately has really brought that to the forefront. And so managing the anxiety of all that's going on in the world, COVID, everything. And at the same time, seeing things that maybe were kind of dormant come to the surface can be, it just adds to the level of anxiety.
Well, and I know one of the things that I've really had to work on as both kind of a professional and a parent was like, okay, so is this, like, why is he acting this way? What's going on, right? So the 1 a.m. to 4 a.m. screaming incoherently for no reason. And I'm like, go to bed. And then all of a sudden the training clicks in and I'm like, he's really trying to control a very uncontrollable situation. And so I wonder if we could talk a little bit about, like, some of the behaviors that are coming out are not behaviors that we normally see. But they're also normal behaviors for a very abnormal experience. And so kind of like what are some behaviors that might be concerning, but really okay? And then how do we know when we probably need to get them in to go talk to somebody, to a play therapist or that level? I'm wondering if maybe someone could speak to that a little bit.
Yeah, I'll speak to that. So we know the norm, like we would expect children to be worried, right? We might expect children to feel fearful, angry. They might have some sleep struggles and things like that. Those would be a normal response to a situation such as COVID. Even, some other fears as well. The problem is how you know when therapy is warranted. And I'll give the general aspect of it. And the other panelists, I know they also have experiences with different ages, and they maybe can pinpoint some of the specific things. But I like acronyms to help me think of things. I know that's going to help parents and teachers and those of you who are listening. So the tips when you might need help. So we'll think about the TIPS acronym. And so T, that's trusting your gut, trusting your intuition. So if you feel that something is not correct, or something is wrong, there's an issue, there's a concern, that is likely definitely the case. I think about the intervention or intervening. Your child is a lot more upset, angry, they're worried. Let's say, for instance, you say, well, let's read our favorite story. Let's do our favorite activity. And so you try to intervene and provide that support, and that still does not reduce what's happening. And then the P, think about the problem persisting. And so this is, no matter what, it seems every single day, they still continue to be super anxious. They still continue to worry. They're sad, and it never seems to let up. And so you really want to kind of get that worry and concern and possibly needing professional help when that particularly persists almost 2 weeks. And then S, one of the biggest ones, thinking about self-injury, suicide. So when the child maybe starts to cut, or, they're biting themselves, they're trying to do things to injure themselves, or they may actually start to say suicidal thoughts. So they may say something like, I'm so scared about getting COVID, I just want to sleep and never come back. And again, those would be some hints generally, again, from a general perspective of what can warrant possibly therapy.
I think that's really helpful, and I really appreciate that. And something that I think that you guys have such great experience in is the I of that you were speaking to, Dr. Taylor, of that what are some of the interventions that parents and teachers can do? What are some of the skills that we know that we've seen be helpful with parents and teachers? And Dr. Opiola, that is kind of an area that you've been really exploring, and I wonder if you might, and I think everyone really can add into this, but some of the skills that you've taught parents and teachers and how to apply them in those situations, that big thing.
Yeah, absolutely. And Dr. Taylor, I really like the tips. I hadn't heard that acronym before, so thank you for sharing that, because it is really helpful. First and foremost, when I'm working with parents, I want to remind them that they know their children the very best. That as a therapist, as someone who's intervening, I really the expert on their own child. So knowing your child best is really important, and knowing what those extremes might look like. So as Dr. Taylor was saying, is problems persisting? If this was part of their normal characteristic before COVID, you might not have to worry about it in COVID. It's just if it's getting to a more extreme, or you're seeing a complete opposite behavior in your child, that's really important to note too. Skills that I find really helpful, and one of the most foundational, is really reflecting to your child your understanding of what they're trying to tell you. So that could be a feeling, that could be a thought, that could be a need, that could be a want. And being able to reflect that to your child, that you're understanding them, can really often de-escalate a situation. So or make it better, is really what I mean by de-escalating. So thinking about, and this is really counterintuitive to what we teach in society, in particular when we talk to adults, but we like to use you statements, because children have a hard time when I say, I think you're feeling, it kind of misses the boat for them. So we talk more about just using you language, like you're sad, you wish you could see your friends, you don't like online learning, right? You don't like meeting your teachers online. So using those you statements are really imperative for anything else we would teach would teach parents or teach teachers to use in this situation, because it is very foundational, and it's the base for everything else that we might teach. The other thing that I would say at this time is because they are not getting opportunities that they normally get, and we were speaking the other day before this panel, and Dr. Ray said something I think really impactful, is thinking about, in March that we would pull you out of your work environment and you would never go back. right, is a really impactful thought for us to be able to relate why our kids are struggling so much right now. Is that their whole world turned upside down in March, and so did ours as adults and caregivers. And I don't think any of us expected it to last this long. And 6-7 months is a lifetime to a child in their lifespan. And so, although I can quantify it and I can think about it rationally, kids are having a hard time doing that. And so, kind of building their like internal resources, so things like their self-esteem, their confidence, and other things right now are really important. And the best way I know how to do that is for you just to have one-on-one time with your child and really adore them and spend some quality time. Our research shows that it's only about 30 minutes to an hour a week of undivided attention from a parent can have lasting impact for a child. So we're not asking you to do this all the time and ask and put this on your plate. But if you could think about one day a week, really carving out time, putting it on your calendar, even if it's a lunch break, or even taking 10 minutes each day to give your child undivided attention where you don't have to split it between multiple children, walking the dog, doing dishes or laundry or whatever it might be, but just carving that little bit of time can really be helpful. And I know my panelists are also really well versed in this, so I'm going to turn it over to see if anyone else has something they want to add that they think would be helpful.
Okay. I was really enjoying listening. So I'm taking notes and listening. Yeah, I think I was picking up on. I also enjoyed Dr. Taylor's acronym, but in the intervention part, that what are those first level interventions that we want to make as parents and as teachers? And really, I think one of the biggest issues is around when you're battling with your child. It's very goal oriented, right? It's usually you trying to get your child to do something that your child doesn't want to do. And I think, and in this environment, which is a higher anxiety environment of COVID and pandemic, you're going to see, your child go to the mat. That's the term I like to use. Go to the mat on what they want. And so to me, one of like that first level kind of intervention would be to change your attitude as the adult of, okay, well, first of all, let me acknowledge what is this goal that I'm really wanting this child to do, and how important is this goal, and can I let this go for 5 minutes? Does this homework assignment have to be done right now? Does this screen time have to be done right now? Do they have to put their shoes on right now? And kind of step back and say, okay, no, I can probably give it a few minutes, and then I'm going to take those 1 to 2 minutes to reconnect with my child and do kind of what Dr. Obiola was talking about, reflect back of you're really frustrated, you really don't want to do this. And not saying it just to get my child to the next goal, but to say, hey, let me just stop and reconnect. And then, of course, and if you have the time, absolutely, I think the number one intervention would be then you allow some free play for that to, for the de-escalation that Dr. Oakville was talking about, for that to take place. If you can kind of just tune in and allow some time. And I think people worry about, oh my God, that's going to be like an hour away. No, you can really help attune to a child and allow the child to kind of slow down a bit by giving them 5 to 10 minutes of your attention and of free play. And so having that as like your first line intervention before you start getting worried about, oh gosh, what's wrong with my child? Do these like first line interventions that can really help. It helps your relationship, it helps you feel better, and it helps your child feel better.
Yeah, and something, Dr. Ray, what you're mentioning makes me remember the importance of thinking about what our children need at this time, and it's that safety, belonging, and control. And everything, that first line of interventions that you all are talking about, I feel like hits right onto that, because when I'm giving you that chance to play, when I'm connecting, when I'm staying calm myself and being with you, you get that sense of safety. And that's another reminder for us to, be mindful when we're working with our children. What's our demeanor? Because we know, honestly, they're not listening to a lot to our words. They're listening to how we're responding and reacting as well.
Yeah, I think to echo what Dr. Taylor's saying, I think really I've talked a lot about working with parents and teachers and mental health professionals for that matter, of like checking in on where am I today? Because if I am dysregulated, I'm all over the place emotionally, I'm stressed out, my kid is, or my student is going to 100% pick up on that, and then reflect that in their behavior, their disposition, however, however they usually reflect their anxieties. And so, really taking the time to, and it doesn't even have to be, it can be 5 minutes to check in with yourself on, okay, where am I and what do I need? Like, how am I feeling and what do I need to shift if there's something about my disposition that's, not sitting well and I'm upset or I'm worried or anything like that. And I think another thing, having like all of our expectations of ourselves, of our work, of our kids are all over the place right now. And I think really taking the time to like maybe even write out and sit down and write out, okay, what were my expectations of those things before? And what can shift? Because this is a time nobody alive has ever lived in. And so, really thinking about how can I shift what I'm expecting of my students, what I'm expecting of myself as a mental health professional to, just better be with and have that opportunity, like Dr. Opiolo and Dr. Ray were saying, to really play and really like adore and cherish your child so that they can really feel that, because that's what's going to have the biggest impact.
Well, and I think a lot of what you guys are saying is so important, and specifically like the checking in on self, right? So I can tell on the days that I have some like big deadline that my child, like something that wouldn't bother me is like, I need you to stop. And I realize that that impacts then my relationship with my child because I've just shut them down, right? And I think like what I've heard people talking about and something we talk about in play therapy and the panelists were discussing is reflecting feelings. And so if we think or trying to understand our child, and so if we can think about ourselves in life and then also in COVID, having a strong person that you can call up and say, I just had the worst day ever. I feel terrible, blah, blah, blah. And it's like, well, how do you want your friend to respond? Say, what did you do wrong? How could you do it better? Or that's really hard and you don't feel good and that hurt you. We're all I mean, I'm personally going to choose, I see the head nodding of the panelists, but we want someone to feel heard with, that we can express ourselves with. And so we want to be that also for our children. Our children need that, and they need someone that they can talk to. And so caregivers and teachers can really provide that. And, as we kind of discuss all of this, we've talked a lot about the relationship. And so I wonder if we might just address the importance of the caregiver child relationship and what that does for children. I know that wasn't kind of what our pre-planned discussion, but I think it keep hearing it come up, and I hope that maybe someone might address that.
I'll jump in first. The parent-child relationship is one of the most important relationships in the child's life. It is their foundation for how they learn about the world and how they find safety with others. And I know that sounds like a lot of pressure, but I think the other thing that is really important to know as a caregiver, as a teacher, as a therapist, is relationships ebb and flow a little bit, and we all make mistakes because we're all human beings. And so there's going to be moments that we have to restore something because we've done something to damage the relationship. As Maggie gave an example, I don't have kids, but I have a puppy right now. And there have been multiple times that I'm screaming at my puppy, and I was just projecting stuff that happened to me during the day onto my puppy, right? And he could tell. And so it's that idea of like sitting back and like getting back in touch with myself in those moments, because our children are learning how to problem solve, how to handle difficult situations, often through our role modeling. So taking a step back and just saying, I made a mistake. I didn't mean to yell at you. And it doesn't have to be in the moment. It can be later in the evening. It could be the next day when you're feeling more regulated, when you can acknowledge and take ownership of that. I'll also say that the relationship with the parent is the one that the children are seeking the most acceptance from most often. And so it's the one that they go to and that they turn to. It's also the relationship that they know they can be their very worst at and still be loved unconditionally. And so sometimes as parents, you get to see the very worst of the relationship between you and your child, because they know you are the safest person to do that with. As teachers, as therapists, as other people in their life, they're still trying to figure us out, but they know you the best because you get to live with them 24 hours a day, 7 days a week. And that's never been truer than during COVID. And so just taking those moments too. And when I often think of relationships, I often think of hopefully ones that I've experienced or ones I've created. And those are the ones that I feel accepted no matter what. In my best days and my worst days. Now, my behavior is not always accepted, but who I am as a person is often always accepted. And so going back to those moments of what do those people do? It's in my worst, they're not judging or valuing me. They're saying, this is a tough moment for Christy. She's not acting at her finest moment. And so I think kids need that, especially right now when they are feeling really stressed, just as you need that as a parent. And that's why your kid tells you, I love you, and they do things for you because they want to show you that. And they often try to make repair through behavior. That was a little bit of a rambling, sorry. But I'll let it to one of my other panelists who might want to jump in.
I was just going to say, I think, yeah, obviously the primary caretaker is the most essential relationship for children. But it made me think, this is a little tangential, but it was making me think too, developmentally, I think it's important to understand that what's happening right now is children are spending, like children of older ages, starting about 4, they need those peer relationships. And then as they get older, that becomes increasingly more important. And those are being limited right now, even more so than their caretaker relationships. And so that puts all the onus on the caretaker and the child relationship. And so I have a lot of thoughts about that, but mostly that understanding as a primary caretaker that it's a little too much to be responsible for, is 100% of the time you are going to be the relationship for the child, when you used to get 5, 6, 8 hour breaks of them developing relationships with their peers. And now you are all they have. And so to me, that's developmentally a mismatch. And so it's going to be stressful for both child and parent. And so I do think absolutely the primary caretaker relationship is the most important. But I think primary caretakers right now really need to be seeking opportunities for how to get children together and how to get them to get some of their relational needs met through peers too. Especially if you're working with like 7, 8, 9, 10, 11-year-olds, they need those peer relationships. So.
Absolutely, thank you. I think that's really important to recognize kind of how important and vital that relationship is. And so I appreciate that. Something else that's come up that I think would be important to just mention, because I think as play therapists, we all recognize free play and we know what that is. But our panel or our participants might not. And so, I think, and you guys can back me up, but, or transition or add in, but, when we talk about free play, what we really mean is allowing the child the opportunity to play what they choose. Without us directing it. And that's not like, let's play a video game or let's play a board game where there's a winner and a loser or where we don't interact with each other, but really like sitting down on the floor and being like, tell me what you want to do, and allowing them to lead and just engaging with them, So it's like you're on the floor and like there's a G.I. Joe and there's a this or whatever toy is around, and it's like, oh, okay, and just reflecting what they're doing and being there and letting them lead you. I think, if children very rarely have the opportunity to be in charge, and with COVID, they have nothing, like they've been ripped out of everything, like we've said. And so giving them 30 minutes where they get to decide what to do can be really, really impactful. And you don't have to get any special toys or anything. You can just do it with your kids and the toys that they have. And it's really kind of interesting too, to see what they want to play. And it's kind of fun as a parent to be able to see how those things come out. So I just wanted to address that.
Maggie, can I jump in really quick? I think an important thing to acknowledge right now is our kids are being exposed to more screen time than they are traditionally exposed to. And so taking those free play opportunities that are screen free could really counteract the amount of screen time that they're experiencing. And so looking at things about maybe outdoor play activities, if that's possible. I know that some people live in areas where that might not be as possible as others. But even like within your houses, are there things that they can do that is not dependent on a screen? So family movie night is fantastic. But all the time after spending 6 hours on screen might actually cause more distress in your child because they're physically needing more activity than that right now. Or you could have the opposite problem where there's more of like, I don't want to call it an addiction, but like an overload of TV where they really are drawn more to that because their brain is kind of being jumbled a little bit about knowing what else to do besides screen time. So things like playing with, depending on the age of your child, Legos or board game, cards, even time like dinner time, helping you create something for the meal can also be playful with your child. So giving some freedom to that, going out and riding a bike, playing basketball or walks. And even if you can't get outside to play basketball, I'm thinking of my friends in California right now where the air quality is really poor. You can set up basketball inside the house with a trash can. And you can do different things inside that can duplicate stuff that they really like outside. And so just thinking about, as you're looking at free play, to try to make it screen free so that you can counteract some of the impact of screen time because we're spending more of it academically because we're virtual for many of us right now.
Mm-hmm. Well, I think that's a really great point, and I appreciate that, Christy. I know for myself, like when it hit in March, I'm like, okay, like I only allowed this much screen time, but now I need a babysitter and I don't have access to anyone. So guess who's a great babysitter? Daniel Tiger. So I'm like, all right, Daniel's on, let's go. We've now, started watching all sorts of things that I never thought that I would allow my 5 and 3-year-old to do. But, I'm managing those expectations, right? But now that we're transitioning into school, where a lot of kids are in online schooling, and that requires a lot of attention and focus for children to sit at a computer and look at a screen. When we were talking before, and you mentioned it also, Dr. Obiola, is the effects of screen time. So would Dr. Obiola, or I know Dr. Ray, you were talking about this when we discussed it earlier as well, is like, what exactly does screen time do? Why is it terrible? Is it terrible? Is it lovely?
It's not terrible. It's not, but we know it's not. First of all, it's very developmentally based. Younger children are not supposed to be having any screen time at all. And then as they get older, they should never have more than 1 or 2. And then now we have our entire education system sitting on screen, and it's just developmentally inappropriate. So one of the things that's happening is it's, there are dopamine punches that go on, like and Dr. Obiola was talking about that. And I would go a little bit further. I would say it depends, just like every other kind of drug, it depends on the child. But yes, some children are going to become addicted to it. And then you're going to see, and we just know this from years and years, that when you try to separate them from it, there is going to be a reaction like an addict. There's going to be a physical, I think that's a lot of times parents don't realize that. They think it's like an emotional reaction. There's actually a physical reaction of separating your child from the screen. And can the child, change what's going on in their brain to calm their brain down to what's normal instead of screen time? It's just constantly being stimulated. And so it's a problem. And I do think that I was just talking to a colleague on Friday about her child and how much she was being asked to have her child on screen, in first grade, 6 hours a day, just completely inappropriate. I'm sorry, I'll get on a real soapbox there because it's just completely inappropriate. And it's causing stress for the child and stress for the parent. And is there really anything, I'm going to just say this one thing and I'll stop talking, but is there really anything in first grade that's so important that you're not going to go to Harvard if you don't get this in first grade? That you make a C in it. Don't do the assignment. If your child is really, if it's too much for them to do the screen, make a C. It's not, those aren't records that are following them down the road. So that's my soapbox on that.
Yeah, no, it's hard. I have a 5-year-old who just started kindergarten, and he is in school on the computer from 9 until 3:50 some days. That's a lot of it. And he's like,
Completely, I just want to say completely inappropriate. Like just sitting, think about how much we love to be online all day long, and how are you getting headaches, and how many people are doing all kinds of things to take care of themselves physically because they're online all day. You're back, children are people. They're more flexible than us old people, but they certainly have those same reactions.
Yeah. So I think we have to be really intentional about off screen time as well. So we know our children are spending 9 hours, which like it was stated before, it's not developmentally appropriate. So if we have any school personnel that's on the line thinking about what your districts are doing to get a little bit more creative, can some parts of the lesson be recorded so the children can come back and do it later? What's the benefits of allowing them? Can they take their own breaks? So some of the same adaptations we would make when they're in the school. But if that is not the case, and I think, parents and caregivers and things like that, what kind of things can you allow the children to do when they get off? So they know the moment I get out of school, my activity is going to be the free play, right? And we know that free play is good. And one thing I wanted to mention, because when free play was brought up, is the idea around another reason why you want to allow the free play. You learn so much about children from watching and interacting and play, and you are not dictating it at all. You really get to be invited into their world and see what their experience is if you just let them play. But things like, let's go out and do a scavenger hunt. Let's do something in the house where we're going to just take 2 minutes to do our favorite activity, and then everyone comes back. And so again, we're being intentional about that screen time. And I'm thinking thirdly, modeling that for our children too. So if we are trying to reduce screen time from our children, we need to be doing the same. So if they see us step to the computer or phone as well, what message are we sending them? And we're like, let's reduce the screen time. So figuring out ways too that they can also see us just freely doing something and not just behind the screen.
Mm-hmm. So go ahead.
I was just going to add one more thing. I think helping to create a routine for children around screen time is really helpful as well. So letting them know when it will be a non-screen time and when it will be a screen time. When kids can predict it, they often accept the value of that. Now, when back withdrawal process of coming off screen time, but being very consistent on your routine is really helpful. And then the other thing is, as they are withdrawing and as you're transitioning to that routine, letting them dictate what a warning they want. So often we would suggest like a 5-minute warning. I think right now where there's such a lack of control, giving kids a choice, like, would you like a 10 or a 5-minute warning? It's your choice. Which one do you choose, right? And I'm using that word intentionally there because I want them to know that they are the ones who get to make the decision. So which do you choose really puts the plate back on or the responsibility back on the child instead of me, and letting them choose it. Now, say they say, I want 5 minutes, and 5 minutes happens, and for a whole week they fight you on the 5 minutes. You can also go back to them to say, it seems like 5 minutes is not enough time for you. I want to ask you again, would you like 5 or 10 minutes warning? Because maybe they're realizing that's not enough time for me to transition. But don't let your child tell you when this game is over or when this is over, because those can last forever. I have 3 nephews who, I early on learned that could be an hour, that could be 30 minutes. It depends on the game they're playing or the activity that they're doing. So really like describing what the expectations are there a little bit, like 5 minutes, 10 minutes, and giving them a little bit of choice of how they can go about doing that can be really helpful. And then having something them to transition to that they enjoy. So it might be a snack time. It might be playing outside first. It might be reading a book, whatever it might be that your child enjoys, giving them that transition time in that schedule to help them go to more free play, because they might need that to be able to disconnect from screens.
Yeah.
Yeah, and I think too, the other thing to add is that, really knowing that they're going to maybe fall apart in that transition. And if you can expect that, then you're going to be in a better mindset to know, okay, this is supposed to happen. This is normal in a very abnormal situation that we're all in. And it is because of what Dr. Ray was talking about. It's like you can liken it to taking a drug away from an addict. It is not like they're not going to let go of it easily. And so if you expect that, then you're much more likely to not get in a power struggle, not pull the rope and get into a tug of war and really just drop the rope on, oh my goodness, they're falling apart again. And we've done the 5 minutes thing and they're falling apart. Yeah, they're falling apart. And if you're their secure attachment figure who makes them feel safe and is there really, they're I'd say they're grown up in the world that really makes them feel like it's going to be okay, then they're going to get through the falling apart.
Mm-hmm. Yes. Thank you. I'm trying to look at some of you guys' comments so that I can get to them. And of course, like I have a new mouse because why not get a new computer right before you do something like this? But I think it would be helpful, and I think Quinn, Dr. Smelser just kind of touched on this, is like, it's highly likely that we're going to have a meltdown. And one of the things that as play therapists, like how to address it when they have those meltdowns. And one of the parents, or the panelists, I'm sorry, wrong P too, participants, had said, like, what happens like with the meltdown, and like, what if you're trying to teach them something, and are you reinforcing that? And so I thought maybe, Dr. Smeltzer, can you talk a little bit about how we set limits within the playroom and how that could be applicable to caregivers and teachers?
Yeah, absolutely. I think, and that's definitely part of mitigating that meltdown, is to really, and I think Dr. Obiola talked about this, really acknowledge their feeling in that moment. Because in that moment, they do not want to put the game down or put whatever they're doing down. And so really saying something like, I can see that you are really feeling frustrated and you really don't want to end your game. So that that they feel seen and heard. And then shifting to whatever you want them to do next. But, we talked about choosing how much time we were going to have, and 5 minutes is up. And so now it's time to put the screens away. And you might have to do that and get creative with your language in it over and over and over. But the importance, the really important thing in that is to acknowledge their feeling and then really communicate what the shift in activity is going to be. And you also might need to get creative in shifting the activity, like you can choose to put the iPad over here, and you can choose to help me do, something like that. And really helping a kid see that you see them, and see that you're not just like, put the screen down, because you're starting in a power struggle. So if you're just throwing a limit or throwing a expectation out there and you haven't seen them, like Dr. Ray was talking about, as like a little human person who also has feelings and also has needs and wants, then it's going to be highly likely that the 5 minutes turns into 10 minutes, but you said 15 minutes turns into, but this game's not ended. And you're starting as the parent to get dysregulated because you're starting to get really frustrated. And so you would acknowledge their feeling, tell them what the shift in activity is going to be, and then really help them through that and be patient with it. You might have to do it a lot. And you're going to feel a little bit like a broken record, perhaps. But so often I see when I work with parents, as play therapists, I get really excited, and this confuses parents, when a kid falls apart in my playroom, because then I've reached a level of safety with them. And so when they fall apart, though, I have to be there to continually show them that I see them, and I know that that's whatever is happening is a real struggle. And that trust that you build through that is such a better it's just it sets you up so much better to be insecure in your relationship with your child, rather than being sort of I think of it as like a top down, like I'm telling you what to do.
Mm-hmm. And I think it's also, as a parent, you have to be ready because sometimes if you give them choices, like now is time to turn off the screen time, or now is time to go outside. You can choose to ride your bike, or you can choose to play basketball, giving them those choices. One of my favorite stories is when we were practicing this out as students several years ago, and one of our cohort members tried it out on her granddaughter, and she was like, if you choose to continue, you can choose to continue to yell, and you can choose to go outside, or you can choose to stay inside and stop yelling. And she goes, well, I choose to poop. It's like, that is also an acceptable choice. And so we will take you to the bathroom and you can go poop. And so sometimes it's the parents having to relinquish some of that control, which is really hard because I think sometimes we feel as if it's our parental duty, like we are in charge and you will listen to us. But that's not always when we think about it, we don't like being told what to do all the time. And I personally don't enjoy it. And I love control. So, our kids want to feel like they have that control too. So like letting them have choices and remembering that, if they give you a choice that you're okay with, if they want to brush their teeth while standing on their head with one leg and, pajama pants on, I'm like, oh, as long as you brush your teeth, right? So it's like, again, monitoring those expectations. And one of the questions that one of the participants talked about was, like wanting to teach them, right? You're not wanting to reinforce those behaviors. And one of the things that I find myself doing as a parent is like when my child's having a meltdown, being like, you need to stop, and that's not appropriate behavior, and that's not okay. And in my head, I'm like, I'm raising a serial killer. It's all over. And I realize, and this is when our training comes in really helpful in the books that we read by Dr. Gary Landreth, is you can't teach a child to swim when they're drowning. And I have to remind myself that over and over again, is like, my child is struggling right now. This is not the time to talk to them about proper, like, putting away etiquette. Like, and that's okay. And so kind of sitting with that. Yeah.
The other thing I was going to say, when I'm working with parents, one thing I often highlight is when you are setting limits and as your kids push back, your empathy needs to go up instead of getting firmer. And it sounds really counterintuitive, but the child's sharing with you, like Dr. Smeltzer said, that I'm having a tough time with this. This is not easy for me to do. And so as we get firmer, they actually root themselves more in their position. And if we can kind of sit back and have more empathy.
Mm-hmm.
And that doesn't mean, just means really share that you're understanding this is really hard for you, and softening your tone instead of making it firmer can actually go a pretty long way with children as they're kind of really losing control and struggling to get themselves under control.
Mm-hmm. Yeah, thank you. One of the questions that we've kind of alluded to, a participant asked, and I think this has to do with teachers. We talked about managing expectations for our children, and a lot of children don't have access to many of the things that they need to succeed in a virtual online schooling environment. And so, I think, how can teachers maybe manage some of those expectations, or do you have any suggestions as to how teachers can handle some of those disadvantages? That's a pretty big question, one that was not prepared previously, but I do think it's relevant. Dr. Opiola, do you want to jump in on that one, or since you're doing some of that research?
I can, yeah, sure. I think first we have to acknowledge that there's not equality in our education system right now. And so to hold every student to the exact same standard is really hard, because as this teacher or parent is kind of brought up, is that for some children, they are really aware that they don't have the same resources, and so are their parents. And so looking at what is the most important in this moment for this child, like what do they absolutely have to do and what is like bonus learning is really helpful. So us kind of like relooking at our standards and our expectations. And I'm not saying shift standards, but just say, okay, what is most important? So at the time that I do get this child, these are the things I can focus on. Is really, I think, important for teachers. And then I also think helping parents know what resources, because some of our educational resources actually don't require educational material. There's things around the house that you can help with. And I'm hoping I didn't lose you guys.
No, we can hear you. No, we can't.
Can you hear me?
Yes, we can. Okay, but I don't think that she can hear us. So.
Well, I was just going to say, yeah, did you want to finish, Christine?
Am I back?
Yes. You're not back visually. I'll just, because a little bit adding on to what Dr. Abila was saying, is we do know that the primary way that children learn is through play. And so for teachers, anything that they can do that adds some kind of play activity with the learning experience, and especially for children who don't have a lot of the resources, if they can give assignments that are rooted in play and getting out there and doing things and then bringing it back in.
And I think that's across ages as well. I think that play is really important. And if we think about, like, for some reason, we've watched Hamilton several times this weekend, and so I have all of the Hamilton lyrics, and I know all about Alexander Hamilton's life. Well, I know that because I was doing it in a fun and engaging way. I learned about him by reading a book, but by playing that music, even adults can really benefit from that. So I think that's something that's really helpful.
Yeah, I think it's just important to just make sure, think anything that the child can learn, again, think about, can they learn that without a device? And usually the answer to that is yes. And so we want to really give a big thanks to what the districts and schools and teachers and personnel are doing. And I know, again, it might require extra layer, but in planning some of those lessons, again, thinking about what portion of this would not require internet connection, what part of this could be something that they report and they can maybe do their own audio discussion about it with me, over the phone or with their parents. And it's something they can still submit. Again, it does not require that screen time. It is not requiring someone to have a resource they maybe do not have, because we know a lot of our families do not have those resources.
Mm-hmm.
I think the other thing too, because this is really highlighting, I said at the beginning of our talk today, like anything that's not functional or was struggling, COVID and the quarantine really brought that to light. And that's true in our homes, and it's true at a societal level. Mm-hmm. And so the education system has failed lower socioeconomic status families forever. And so often I think about the intersection of that with race. And so what we are seeing, I think, in the summer, teachers refer to this as like the summer slide. And, you're not really focused on school in the summer. And so you come back in August, September as a student, and teachers are like, we learned this in December. Why is this not, and there was just this gap. And I think shifting to, there's going to be a COVID-19 slide, and just accepting that is the truth. And that's going to be really difficult to manage. And we're going to see that the most in our economically disadvantaged groups. And for me, it's a really sad reality of what is happening. And so I think of it at a policy level too, of trying to shift and trying to have impact on the bigger educational policy.
Mm-hmm. And to be fair, we really do not know the extent of this pandemic on our children. And I think that's just the reality of it. But I think it speaks volumes to what we talked about before. We do know our children are pretty resistant and adaptive. So if we can give them good relationships safely and social relationships, if we can give them a chance to engage in some of these play activities, build their social skills when they get back, even if there are opportunities that need to be repaired, when they get back into class and we get back into the classroom, they will be able to retain that. Again, it might be some reteaching that we'll have to do, and it will be the responsibility of our educational system to figure out how we fill in the gaps, but the extent of what that will look like, there's really some uncertainty around that.
And the other point that I would make is that confidence and like their belief in themselves is going to be so important, because as as there's going to be big drifts between what kids know when they come back, and that expectation that some kids are going to stay where they should be and some kids are going to be behind of where we're expecting them to be, that if kids feel bad about themselves and have low self-confidence or low, we call it self-efficacy, right? That is actually going to have a bigger impact and make that drift wider and wider. But if we can have them know that they're, have a lot of strong strengths and qualities, that actually will help them catch up quicker when we get back into the classroom, because they have a belief in themselves. So looking at ways that we can maintain their belief about being smart, their belief about that they can handle difficult situations, that when they get frustrated, that doesn't mean that they're unintelligent or that they can't figure it out. So those type of skills are going to be really important for our children. So that social emotional quality is so important when we do get back to a more traditional school setting.
Yeah, and I think to add to that, we were talking about parents. Having the biggest thing that I remind parents, that I remind school counselors, that I remind students, clients right now is, as long as a child has a secure grown-up in their life, and if a teacher can connect with a child via phone or however, that even might be enough. They just need somebody that helps them to feel safe and helps them to feel secure and like things are going to be okay. And so if anything, if we can find ways to connect with kids, I think that's going to be sort of what buoys us through that transition. That might be like a speed bump transition back into, I don't know, normal society. I don't think some of the things should shift back to how they were. They should definitely change, but or it might be like a small hill, right? And just like knowing that, okay, if I provided security for this child, then that's, I did really well through this time.
Mm-hmm. Dr. Ray.
I just want to shift gears because I know we're coming to an end, and I noticed some of there are several questions around screen time, free play screen time. And I just wanted to address that I'll give a little boring thing about, I was in an early childhood conference earlier in the summer, and somebody had done a study, and in the study, preschool children, 80% of their adult interactions were directions. 80% of their verbal interactions with adults were adults giving them directions daily. And I thought that was an amazing thing. And it just fits to, in every generation across history, children need a time apart from adults telling them what to do. And they create it in negative ways if we don't allow it to happen in positive ways. And so, yes, absolutely, I do think children do need free play screen time. It's just, we just have to, and I would say, even go so far as say, sometimes maybe you need to replace some of the structured screen time with some free play screen time. That being online 10, 12 hours a day, not a good idea. But yeah, being able to, again, I think Dr. Ola mentioned, like having a structured time, like letting them know, when is this time that I'm not going to be all over you, I'm not going to be monitoring you. You can have this time with your friends online, or you can have this time with you online. I think is essential, and it is part of free play. We still want the active free play, but absolutely they're going to need free screen play time. I just wanted to address that because I saw a few questions around that.
No, I appreciate it. And I know there were a lot of questions that you guys had that we weren't able to address. I want to be respectful of the time. It's 5:58. I also just want to let you know that we as a panel have created some resources and links to some books that could be really helpful that we'll send out, as well as a link to the Association for Play Therapy. And the link that I provided should let you go straight to the Find a Therapist. And so if you feel like this is something that you really need, I think it can, or that play therapy would be beneficial, whether it's that you can have a lot of what I'm doing is teaching parents how to use these skills to build their relationship, or having someone work with their child. So it'll link you and you can tell where you are in the country, and they'll be able to give you a list of play therapists. I also want to give the opportunity, is there anything else that you guys would like to add in the next 1 minute that we have? I feel like we could probably talk about this for a couple hours, and I want to really thank the Graduate School of Education and Human Development at George Washington University to allow us to have this conversation. I think it's really relevant and it's important. And parents are overwhelmed, and so having others, and I also appreciate the opportunity to be in the same room as all of the panelists again. So thank you very much. Victoria and Meg, is there anything we need to do?
I think you're good. That was wonderful. Thank you all very much.
Thank you, Dr. Parker.
Thank you.
Thank you, guys. Bye.